Thank you very much. I actually am a BSN graduate from Texas Tech University Health Sciences Center, but I am really glad to be here. Thank you for this opportunity. I love working interprofessionally, and I started as an LVN. I was young, and I thought this is a great way. I knew I wanted to be a nurse. Went to school for a year at Amarillo College, and one of the funnest parts was that I was at a little bitty hospital, and when you rotated through different areas, you worked interprofessionally. And they didn't look at me like, oh, well, you're a nursing student following me around. They looked at me like, okay, you're in dietary now, you're gonna be delivering trays, this is what you check. Or you're in the lab, now you're gonna run these tests, you're gonna do strep tests, all this kind of stuff. So I really got doused into it, and probably kind of naively, I thought that's how the world was. So it isn't, and I found that out. So I'm gonna talk to you about, this is what I did for my research, for my dissertation. And we all know, we're all nurses, we all know that we've worked interprofessionally from the very beginning. That's how we work. We know that's how it works. So when you look at these problems, these are mostly provided to us from the Institute of Medicine, and they're accredited to a disjointed healthcare system due to a lack of collaboration. And we understand that nurses understand that we have to work interprofessionally to get the best results for our patients. We communicate that way, that makes everything lots better. But even though we know that, it's been more than 20 years since the publication of To Err is Human, and now medical error is the third leading cause of death behind heart disease and cancer. So interprofessional education is an educational tool where two or more different professions learn with, from, and about each other. It gives students the opportunity to learn about other professions, to see what they know, to share what they know, to talk, to develop relationships. And it creates a safer environment for our patients. So when I was doing my research, I did an extensive literature review on a lot of different things. And these are the things that I did a literature review on. Interprofessional education has been around since the early 1900s, with an increase in activity and publications over the last 40 years. The Institute of Medicine and the World Health Organization have both advocated for teaching our students using a team approach to healthcare. These aren't the nurses, and these aren't the doctors, and these aren't the respiratory therapists, we're a team. The Institute of Medicine also, by the publication, The Future of Nursing, or the last one they did about nursing, they challenged us as nurses to work to our highest potential, use our knowledge and our skills and our abilities to address the deficits that we're seeing in healthcare. So interprofessional education offers us a lot of opportunities. It has benefits like students learning from each other, organizations that now support healthcare being more diverse and being together. They don't necessarily, organizations that don't see us as separate entities like those silos that we were educated in. It also improves job satisfaction. But there are barriers, they're real, and they are hard to deal with. And they are usually very common. And you will hear more about that when I talk about my talks with nursing faculty. So nursing education uses IPE to teach their students about working as part of a team. They give them examples, they help them experience all those kinds of things. Through interprofessional education, nursing students get a real idea of what healthcare is going to be like when they get out into the real world. So I also use reflective practice in my study. Reflective practice started with the work of Dewey and Schoen. So Dewey saw reflective practice as being kindled when you had a question or a concern, when you were thinking about something. And Schoen saw it as a way to develop your future knowledge, your future planning, and all those kinds of things. But he also could see that when we use reflective practice and we're looking at problems that we're having or problems that existed in the past, we can come up with solutions that might be possible. Reflective practice encourages contemplation and thought. And I want to share a quote with you. Jacobs believes that reflective practice in nursing correlates to the development of the critical, autonomous practitioner and is necessary to enhance interprofessional education. So all of those reflective writings that you're having to do or that you've done in your education, they're really helping you be a better person. The methodology that I use is phenomenology. The reason that I chose it is it leads to a better understanding of the experiences and the understanding of the phenomena rather than being about the phenomena itself. So even though interprofessional education was what my dissertation was about, it's really about how nurse educators understand it, how they implement it, and how they integrate it into their curriculum. So it encouraged reflection by the participants. And what it did is, so when I hope what it did, when I talked to the educators, they thought about what am I bringing to the table? What am I bringing to this discussion that I'm having with Anne about interprofessional education? Their past experiences, whether as an individual, as a practicing nurse, or as a nurse educator. So these are my participant demographics. I want you to be sure and notice the names. When I was doing my dissertation, we had numbers and we had letters, and my qualitative professor was like, what stands out to you about nursing? And I thought of a lot of stuff that I told her, and I said, the people that have made us, that have helped us get to where we are. And she said, then why don't you use that? So that's how my participants are named. It has nothing to do with them in particular, but these are all famous nurses. I interviewed 9 nurses who are all nurse educators actively teaching in traditional undergraduate BSN programs and working with interprofessional education activities. They were aged 32 to 64. 5 of them were 60 and under, 4 of them were over 60. They had had 10 to 42 years of practice as a nurse. That includes either working as a nurse, and then they'd had an average of 9 years in nursing education. And they were quite fun. Okay, so these are the questions, the research questions that I use. The questions center around nurse educators' understanding, experience, and integration with interprofessional education. So in phenomenography, you develop an outcome space. And the outcome space comes from when you review your data, you pick out common things that you keep seeing over and over and over. So I used a highlighter, and I would go through and mark different things. I used different colored highlighters because that helped me put the information into categories. And I came out with 4 categories. The first one is interprofessional education as a way of developing teamwork, interprofessional education as a faculty role, interprofessional education that is constrained by barriers and limitations, and interprofessional education that is unique to nursing. Okay? This isn't about any one person's interview. This is from all of the information put together and analyzing it like that. And from now on, I'm going to try to say IPE so that it's not so much of a mouthful. Okay, so what we're going to do is we're going to look at each of the categories, and I'm going to share with you what I found. So the nurse educators believe that IPE is a way of developing teamwork. They facilitate interprofessional education events, and they see the students sharing with other professions, professional students. They're talking about their role, they're talking about what kind of classes they take, why this one approaches the patient this way and why this one approaches the patient a different way. And in interprofessional education activities, we usually give the students a case study. That's very frequent, and the students work their way through the case study. Well, we know that because of their education, different professions take a different approach to what they want to do and what they see as important and what information they may want. The nurse educators are there to help everybody feel safe and everybody participate. Sometimes in an interprofessional education event, it can be kind of scary, or somebody can maybe silence the group because they have this voice of authority. And maybe you don't know so much about that, so you're like, well, I'm not going to say anything because that's not my experience. So the nurse educators saw themselves as their role was to make it safe, make everybody feel like they had a voice, that they had something that they could say, not put anybody down, but to make it someplace that you could learn and grow and develop. They wanted the experience to challenge them, but not to intimidate them. They saw that communication is the key emphasis to IPE. Communication was the most important thing. They guide the IPE activities to ensure that everybody had the opportunity to speak. They describe the faculty position as working in these learning opportunities to make sure everybody got to participate. They also saw IPE as allowing the students to practice their profession with other professions before it was their responsibility, before they were in that professional role. They wanted opportunities for them to learn at the same time as other professions. They nurtured and encouraged students of all professions. Doesn't that sound like nurses? We don't just say, oh, well, I'll help you because you're a nurse, but I'll help everybody. And try to make everybody feel like they could ask them, that everybody was participating. They also provide a cushion of safety. So they're right there. You're not afraid. You're thinking outside the box, and you're not afraid to go out here, but you know you're not going to get lost because there's somebody there that's guiding you, that's facilitating the exercise. IPE can be uncomfortable, it can be stressful, and it can be intimidating. And that's one of the reasons that we really need faculty to be involved, because they help keep it safe. And that was a big thing that they wanted to talk about. They also believed that IPE provided reinforcement. So there are lots and lots of different members to the interprofessional healthcare team. And we want to be sure that nursing students recognize all these diverse parts, because they come together as one group that's going to influence the patient's care. And it may not always be somebody that in our mind we think of as a health care provider. It might be a social worker, might be dietary. There's a lot of people that we use that are really, in a way, healthcare providers because they're enhancing the healthcare providing. So being able to work with others was critically important to nursing educators for their students. And even though sometimes it was hard, they really believed that IPE activities were worth the effort. Okay, so this is interprofessional IPE as a faculty role. So nurse educators believe every healthcare provider should be involved in IPE. We don't want it just to be nursing, and we don't want it just to be nursing in medicine. We want everybody to be there. At the Health Sciences Center, most of the time it's nursing and our health professions department, which is PT, OT, our labs and all those kind of things. Those kind of seem to be the groups that are always there going, yes, we're ready to go. So they want it to apply across all professions because it's better when everybody's represented. When somebody's not represented, then somebody has to stand in for their voice. And a lot of times, I don't know if any of you of faculty have served in the facilitator role, if somebody's not there to represent a position or a profession, they look to the faculty to say, okay, so what would they say? What would they do? Well, I don't really know. I mean, I have my opinion, but I wasn't educated in that field, so it's so much better to have them there. Nurse educators see planning interprofessional education as a commitment for faculty. You have to want to do it, you have to desire it, you have to see its importance, okay? Working with other healthcare professions to plan an interprofessional activity helps you to grow a relationship with those professions. It helps you to better understand where they're coming from. We're also role modeling when we do that. Students are smart. They can see very clearly if everybody's represented, if everybody's equal. So it also helps us to get rid of that hierarchy. I don't know so much if it's still there, but when I was going through nursing education and when I first became a nurse, there was a hierarchy. And you said Dr. Ford said I was over director of admissions, and I hear that sometimes when we interview our applicants. Well, the nurse reports to the doctor, or the nurse helps the doctor, and the doctor helps the nurse also. It's a two-way street. So the nursing faculty felt like it was very important for everybody to work beside each other. One of the quotes from Virginia was, "The experience is better for everyone." Some of these faculty that I interviewed had problems implementing IPE in their programs. So one of them said that there was jockeying for power and prestige, that it was this ownership even down to which building we were going to have it in. And you can see that's very unfortunate because nobody really cares. I mean, overall, the building is not that important. Respect and trust are essential for planning of interprofessional activities and for those kinds of relationships between professions. So when they got to work with other professions, they developed personal and professional relationships. Dr. White and I, pre-COVID, we used to walk inside our building for exercise, and the third floor is the health professions floor, and it was really fun to walk through there and see the people, the faculty that we had done IPE activities with, and they remember you and they ask about you and you talk about them and you catch up briefly, and that's how we grow, and that's how we provide better care, because we're not afraid to talk, we're not afraid to ask questions, we're not afraid to seek further information from people that we're friends with and that we trust. Okay, also, just like in interprofessional IPE for students, communication between faculty is really important. And you can see these are some things that they said, giving students that personal connection and the experience faculty have had with it. The nurse educators talked about they felt like some professions just don't want things to change, that it's harder for them to step outside the box and consider how it is. And I don't want you to think that I'm saying one profession is all that way, but there's some members of different professions that really feel that way, that don't want to be involved. They want to keep the status quo. It's worked this way for 50 years, let's just keep doing it this way. But it really hasn't worked, because medical error is the third leading cause of death, so we've got to do something better. They believe that in academia, we need to do better with our professional relationships with other professions. I liked this first quote under personal connections. We are on a team, but we don't practice as a team until we get on a team. You really have to know a little bit about who you're working with before you get with students and try to work with them, because it just doesn't work very well. They support planning in fact, nurse educators support planning IPE to be part of the faculty role. They value the relationships that they've developed with other professions, and they see how it is productive and enhances the student's education. Okay, IPE as something constrained by barriers and limitations. So there are lots of barriers and limitations, and I want to be sure I tell you exactly about barriers. Barriers are identified as difficulties that prevent people from working together or communicating accurately. Limitations are boundaries or roles which restrict an individual program, an individual, or an institution. So there can be institutional, programmatic, or curricular barriers and limitations to IPE. Very seldom is there just one problem. There's usually more than one problem. So physical space is a problem, because usually when we do IPE, we don't just have 5, 5, 5, 5. We have more like 50 and 75 and 30, and we're trying to get them together, and we're trying to get everything going. And even though we can separate them into groups and move them into different locations, that kind of, to the nurse educators, that seemed like it caused a decrease in the momentum or the energy level that they had participated in. One of the IPE events that we do is our fall symposium, and we usually have a speaker, and everybody's together, and you hear this speaker, and you can just kind of feel the excitement and the enthusiasm as they talk, and we get all in, and then the separation starts, and that raises the anxiety and causes, some people slip out and they don't participate because they don't know that person, or they don't want to be away from their friend, those kinds of things. Schedules is another problem. So most of us know nursing schedules. Well, nursing schedules are very different than other professions' schedules. So trying to navigate clinical, didactic, and simulation from different professions and find a time that works is hard. And also, scheduling the right mix of students is hard. We don't want to intimidate anybody, but sometimes if one group has had more education or more experience, then that intimidates the other group. And we've seen this a lot trying to work with medicine. Medicine has been, we would love to have them participate with us, but nursing moves quickly through their education, and medical students take longer. And so even by the end of their first year, they haven't had any clinical. And so if you put them in a situation where you're having to make decisions about clinical care or call a code or run a code, that's very intimidating, and you can see why they don't want to practice, and you can see why their professors don't want them in there, because it scares them, and that's not what anybody wants. So that's part of the problem with scheduling. Time is another problem. We already talked about trying to find the time in schedules. There's also time to develop relationships. If I decide, hey, this would be a really great idea for an interprofessional activity, but I need this person and this person, it takes time for me to do my job and then also to go out and find somebody in another profession. We decided that it'd be great if you could just have this board that you went to and said, oh, these people are interested in IPE activities, specific ones. Also, we want more. No day in the life of a nurse caring for patients is uniprofessional. We don't get to the hospital and take care of them and just do it all of ourselves. Every day is interprofessional. So the nurse educators really enforced that one and done was not enough. It's got to be more often. Another problem is lack of practice as a team. In a good hospital setting, in a good environment, then we see interprofessionalism happening all the time. But there are always bad examples. When I went with my students to the hospital, one of the first things I remember seeing is we were down at the nurses' station with the nurses, and our doctors a lot of times round in teams. And one of the teams came around the corner and was started down the hall, and you could almost hear this, well, it was an audible, And, you know, I kind of looked around and they're like, well, here comes the doctors, you know. Like, this is just going to mess up the whole schedule. My whole day's gone to pot, or the next 2 hours anyway, because they're here. And I thought, that's not the impression I want my students to have. I want them to be excited about this opportunity to learn. I don't know how we get rid of that. That's a problem beyond my scope. But here's some quotes that I've got from the faculty. A lot of defending your turf, lack of confidence in your profession, or fear of sharing. Remember, some of us remember when nursing did all of wound care, and now physical therapy does a lot of wound care, and they do the wound vacs. And I wonder, did we have a fear of sharing? That happened, I guess, when I had my back turned, and it just happened. And I appreciate the fact that they can do that, and they can help my patient get better while I'm doing something else that's my responsibility. Okay, so this is our last one, and I thought when I came up with this category, I thought my committee was going to go, because I had people that were not nurses on my committee. They're going to go, this is not true. So these 9 nurse educators did not have interprofessional education as they now understand it when they were going through their beginning nursing education, okay? But when we sat and talked, they could remember that their clinical was very interprofessional, that they learned on the job, right there, you know, no preparation. They often felt like they weren't ready to communicate with other people, okay? But one of the nurses, I think it was Virginia, said, nursing is the hub for communication. And I think we often tell our nurses now, especially our traditional nurses, you're the case manager in the sense. You're the person that manages the patient's care. You see every person that's in and every profession that's in and out that door that's being consulted, every order, all those kinds of things. And that was a surprise to a lot of these nurse educators as they were becoming nurses. They learned interprofessionalism as they had the patient's responsibility, okay? So they're there taking care of the patients, and they're learning, oh, I've got to make sure the doctor knows this. I've got to make sure the pharmacist checks this med, all those kinds of things. I thought that was a really good thing. And one of the nurses that I interviewed, Virginia, described nursing as the linchpin. So those of you that know what a linchpin is, it controls so much. It keeps everything stable, okay? She stated, it is vital that we understand what each profession has to offer the patient in order to best coordinate care. I can't make good recommendations for my patient unless I understand what professions are out there and what they have to offer. So, like I said, they didn't have interprofessional education, but they were immediately forced into it when they were nursing students in clinical and when they began their careers. A lot of them felt like, I wasn't ready for this. I didn't know I was going to have to talk to the doctor and say, no, this is how it is, or the patient's having a reaction to this medicine that you prescribed, or all those kinds of things. So because of their experience, they believe that teaching nursing students about in IPE activities and about interprofessionalism is critical to their success. And they want their students to have that experience early and often so that when they get to the real world of healthcare, they're ready and they know what's going to happen and they know what's out there. They want them to be more well-rounded students. One of the things that they mentioned was they encourage the nursing students to stay in their patients' rooms when another profession comes to talk to them, when PT's there or OT or the doctor. And the motive is very simple. The nurse educator said, when those professions are gone, when they finish what they're telling the patient and they're out the door, you're the one that's there. And the patient's going to have questions. And you need to know what the profession told them. You need to know what the instruction was, what they were supposed to do, if you're going to be able to help the patient. So they value IPE as opportunity to learn about other professions. I liked this last part the very best, glue for the team. Nursing is not the be-all and end-all, but they're the glue that holds healthcare together. They grasp the need for nursing students to have IPE experiences. They feel like it grows them, it makes them more confident, it encourages them to ask questions and to be better nurses. Working together as a team is a significant accomplishment for any group in any profession. But in healthcare, it's critical because the patient's lives hang in the balance. And so nursing is very, very important for us to know what we're supposed to be doing. So when we look at these 4 questions, the nursing faculty understand what IPE is. They know it's working with other professions, and they want it for our students. They believe it is critically important to their development. They see that it makes better teams. It helps them understand that healthcare is a team, that it's not just following orders, it's asking questions, it's seeking guidance. For the second questions, they have implemented it. They work to find other faculty and other professions that want to do IPE. It's that important to them. That's not part of your job role, that's not on your workload, but that's something that you want because you believe sharing roles and having them participate with it is really important. They bring, when they don't, and not always is there an opportunity to work interprofessionally, but they bring it into lectures, they bring it into simulation. Even if we don't have the other profession there, we talk about who else would you want on this team? What would you want to know from that team? The third one, what were their experiences? Their experiences overall were very positive. They talked about the excitement of the students when they're talking to other professions. They loved to hear them asking them questions. They thought it was wonderful that they developed camaraderie and friends. We have a really great place at the Health Sciences Center, and it's called the Synergistic Center. And faculty can't go in there. My badge will not take me in there. It's only for students of every profession. And it's really fun for me when I can see my red scrubbed students sitting with medical students and pharmacy students and health profession students, and they're talking and they're visiting. Even if they're just having lunch or they're playing foosball or whatever they're doing, at least they're interacting with the people that they're going to work with for the rest of their lives. So what are their goals and desires for future IPE? More of it, regularly scheduled, so it's a natural part of nursing education, that it's something that we know this is going to happen. It's not like, do I have to do that? Is this a requirement? It's just natural. It's the regular thing. It's what's expected because it's what's expected in healthcare. So implications for practice. This is really probably a crazy idea. I think it would be great if for faculty or faculty that teach, that we had interprofessional education. That's just for the faculty, not just one time that we do it, but we do it regularly, and that we get to learn and we grow together and we talk and we do case studies or scenarios or something like that together. It would be a wonderful opportunity for us to bring in our partners in the private sector, because they in the practice sector, so they could help us keep our IPE up to date, current to what practices are. Also, it would build that relationship and help us to be able to look at the transition to practice. What do we need to do better with our students to make transition to practice easier? Also, I think our faculty never talked, the faculty I interviewed never talked about faculty development. But when you read the literature about IPE, faculty development has been tried and used in different places, very limited. When it was used, it was successful, but the nurse educators never even mentioned faculty development. So there is significant concern about, like I talked about, transition to practice. There was a study done a 10-year study by the Robert Wood Johnson Foundation, and it found that 18% of first-year nurses are leaving their jobs. And that's really concerning because Dr. Ford and Dr. Long and Dr. White and I, this is our passion to ignite that in students and to make, I love nursing. I love my role. I love taking care of people. I can't imagine having left in my first year. I was still so naive about so many things at that point in time. And so I wonder if maybe if IPE was natural in our curriculum and regularly occurring, they could get to know other professions, they could work as a team as a student before it was their responsibility, before they're carrying a patient's life in their job, if that maybe would ease the transition to practice and help the turnover to decrease. So there are limitations to the study. It was a small purposive sample. As I told you, all of these faculty members were actively involved in IPE, which right there tells you that they valued it or they wouldn't have been. 4 programs were represented. I used audio recording. That's considered a limitation because I just knew that, for me, yes, it was on my calendar, and I cleared a whole hour and a half, because I wanted to listen to them and I wanted to think about what they said. But their schedule may have looked very different, and things could have come up, and there could be demands on their times or things that were not allowing them to think freely. Reflective practice is not natural to everyone, and so maybe that wasn't something they were comfortable with. And also, I'm a very novice researcher, so that was also considered a limitation. In my final summary, I would like to say that the group of nurse educators that I interviewed had a great understanding, integration, and experiences with IPE. They really valued the experience. They have so many great ideas, and they can see what it does for our students and the advantages it offers, and mostly that they can see that it can improve patient care if we'll just communicate and be able to work together. And they feel like nursing has the motivation to move everybody forward, so I really hope that's the case. Thank you.
I forgot. All right, we'll see if I can get everything going the right direction. I've been known to be technology challenged occasionally. So I have known Dr. Hagstrom for a very long time. We go way back. I even had her youngest son, Matthew, in my 3-year-old Mother's Day Out class, which was a lot of fun. We worked as school nurses together, and I really enjoy teaching with her. She is a wonderful role model for me. When she told me she was going back to school to earn her doctorate, I knew that she was going to do interprofessional education because she does love it, as she has said, and you can see when she talks about it how passionate she is about it. So through her wonderful example, several faculty have become more and more involved in our IPE at work, me being one of those. Simulation is what got me there. IPE and simulation kind of helped keep me there. Let's see, I wrote some notes down while she was speaking. If people would just participate a little bit more, they would realize it really is fun. And you learn while you're having the fun because you do learn about other professions. There's a lot of things that we don't know about other professions and things that they don't know about us that we can bring to light a little bit. I think if lay people realized, excuse me, my allergies are going crazy because of all the dirt. But if lay people realized how important interprofessional education was, not only in saving lives, but also in saving money, they would be more for it, push it a little bit harder. Everybody needs to be able to work together as a team. So not just medical or healthcare professions, but also lay people would be pushing forward a lot more, I think. It is not currently necessarily taught in a lot of curriculums, or wasn't when I was in school, not formally. But I look back on my class that I had my last semester of nursing school, and I'm one of those that's been a nurse for 42 years, so it was a long time ago. But my leadership course, in a way, did teach me interprofessional education because I had to be the team leader on the floor. And yes, there was, a more experienced nurse there to help guide me, but I had to talk to the doctors when they made their rounds. I had to talk to the respiratory therapists. I had to talk to PT and OT. Just all those different disciplines, anesthesia, all those different disciplines that are involved in caring for patients. Even though we didn't call it interprofessional education, that's what it was. And looking back, like I said, I didn't really think about it being that at that time. But it did teach me how to communicate with other people, taught me a little bit about, who does what. That's one of the hardest things I think for our students is, okay, this is what I need, but I'm not really sure, do I call a case manager? Do I call a social worker? Who do I call? And so learning about IPE and the different roles and responsibilities really helps our students in that area. I think that people would realize also, if they would participate more, that it's not just valuable in your job, but it's valuable for life in general. You have to work with other people in everything that you do. None of us are isolated and alone, even though we felt like it over the last year because of COVID. That's not true. In general, we have to work with a lot of other people in life to be successful. When I do some of the IPE events, it's really interesting to watch the dynamics of the group. Dr. Hagstrom touched on it a little bit about how some are more powerful, more knowledgeable, or others in the group think they're more knowledgeable. Maybe they're just better at BSing their way through things. That's not a very nice way to say that, but some people are better at that. Well, yes, I do know, even if they really don't. They exude that confidence that makes other people follow them. And typically, when I see in my groups is some of the nursing students will kind of hang back a little bit because they don't feel as knowledgeable. They'll let the medicine school people or even the pharmacists, if they're talking about drugs. So just sometimes a little push, a little nudge to let them show and shine what they do know is important. It gives them that confidence to talk more about it in their group. I also found it was very interesting when I was watching her PowerPoint that faculty are resistant. Why? I don't understand that at all. Why would someone be resistant to understanding how to better prepare their students for that transition to practice? Part of it, I guess, is that we've always done it this way. Why change it now? Nurses have been doing their jobs, in a good way forever. Why do we need this? But that teamwork that, like I said earlier, that saves lives and saves money is very important. The silos are really hard to overcome when we're doing scheduling. It's not just, okay, this schedule, Tuesday I'm free, but they're not free. It's also the level of the student, as she mentioned. You don't want to throw first-year students in with ones that are almost finished because they do feel inferior and kind of get a complex a little bit. But it's also, I lost my thought. Let's see. That's what I do different semesters. So different semesters for nursing school. It's not just a different level of student, it's also the ability to find different activities. For example, in the summer semester, I know that we have an asthma camp that we can help with. And our students get to work with pharmacy students, respiratory therapy students, and every once in a while we'll have a med student thrown in there. But in the fall, we do something called a toy fair, where we work with OT, PT, speech and audiology, pharmacy, School of Medicine, if they can work it into their schedule. And they're really fun events. So our students, it's easier to get them to come to stuff if they're gonna have fun, right? Than if they're just sitting in learning about something. If they're actually engaged, that active learning and having fun, learning about other professions, it makes it a lot easier to get them there. Of course, we do require it for their course, but they have a better attitude when they come if they know they're going to have fun. So it sounds easy, yeah, just put another course in, just put an IPE course in there. But due to the constraints that she talked about, the different barriers, getting people involved, the scheduling, our curriculum is already very packed and very fast-paced. So getting those opportunities really present a challenge. And I always wonder, do other healthcare professions have those same challenges that we do? I feel like some do, but I feel like nursing sometimes takes things more seriously, and maybe that's because I'm a nurse, I'm always for the nurses, but I often wonder if, and I'm not picking on the doctors, but I often wonder if the School of Medicine takes it as seriously as we do, because typically it seems like they're the ones that we have the hardest time getting to our events, and I know their schedules are crazy too. We did have had an opportunity one time to have the OB residents come in and help do our simulation where we deliver a baby. And it was so much fun for me. I don't know, maybe it wasn't fun for them. They haven't been able to work it back into their schedule. But anytime you can have that opportunity, even something as simple as just having them come, it only took them like 15 minutes to come into and do the simulation, but it made it so much more realistic for my students. And that way they could see how the nurse helps the doctor, how the doctor helps the nurse, and even the different people that you might have to have involved in a delivery, like a respiratory therapist or an anesthesiologist. And when Dr. Hagstrom was talking about the turnover, that's another thing that I wonder if other healthcare professions have that same big turnover that nursing has. I don't know the answer to that, but it would be interesting to find out. And so that's all I have. IPE, important in more ways than you can imagine, and learning that teamwork is great for our students. We hope to be able to do more. All right, well, thank you for having me. I appreciate the opportunity. And are there any questions? Okay, thank y'all. Questions?
I have one
Okay.
while they're thinking.
Okay.
Many times when you do a research study, it generates more questions in your mind. You set out with a plan. This is what I would like to answer. If you did a second study, is there something you would like to look at?
I would like to look, so I did just Texas. All the nurses that I interviewed were in Texas. That's the state I'm familiar with, the regulations that I'm familiar with. I would like to know more about their activities. I think I would like to investigate even and maybe include more professions. I have, like Dr. White said, I've worked with interprofessionalism at the Health Sciences Center I've been there 11 and a half years, and I am the School of Nursing representative on the IPE steering committee. And it is amazing to me how slow things are. Like team steps. We teach team steps as a communication tool to our nursing students. They have to have it in the very first semester. They have to use it throughout their nursing education. They have to when they come to me with a problem, they use SBAR to talk to me about the problem. And it's really kind of becoming required almost everybody. So you would think, couldn't we just have like one class offered all different times of the year? Students know that I have to get this done by a certain period of time. That's documented by their profession, their curriculum. Schedule it in some time like that. And then what usually we do, we have recorded classes and then use simulation for the team steps activities, which helps you put all those concepts into action and practice those skills. You understand. One thing I have learned over time, so our medical students, the very first year that they're in school, and maybe more than that, but the first year for sure, are not taught by medical doctors. They're taught by PhDs, EDDs, and that may be part of the problem with incorporating from the beginning to them interprofessional education, because it's a different approach. I mean, it's like taking pathophysiology at a university or chemistry at a university. That professor knows when you're in their class and in their lab, but where you are the rest of the time, they don't really know.
I have one more thing to think
Sure.
about. I've been in the millennial literature just a little bit, and I know that you have students that are the millennial generation. And one of the things that they desire greatly is that they feel that they make a difference in what they do. And so by your thoughts of IPE, it seems that that would meet that need, as I'm a part of a team and I have value as a team member.
Right.
So from what you have presented, it seems that that might be a retention strategy to keep our millennial nurses with us.
With us.
Have you seen that in your practice?
I did initially, when I first started at the Health Sciences Center, I did a study with Dr. Ken Nugent, and we took medical students and we put them with nurses, either both in the ICU and in the clinic, and then we took nursing students and put them with doctors in the clinic and doing rounds in the MICU. And then I interviewed them at the end of our study. It was amazing because, when you're a senior medical student, you've usually completed an undergraduate degree, so you're probably getting close to 27, 28, maybe 26 if you started real early. And some of them were just passionate about, why haven't I had this opportunity all along? I needed to see this. I needed to hear what was going on. I never knew when I went into the room that the nurse had already asked them all these things. I could have been asking the nurse and talking to them, or been in there with the nurse. And it was so fun to listen to what they had to say. And the nursing students, of course, were younger because they're just getting their undergraduate degree, so 18 to 21 mostly. And they were like, on rounds, the doctors asked me what I thought. What would you expect for the vital signs to be? And they were just like, I'm important. And I think you're right. I think that may be a grand way for us to engage our millennials even better.
Have you presented this other places?
No, I
You
haven't.
present
Well,
so
to my
well.
faculty.
Your
Well,
faculty.
thank you. I
present
appreciate
so
that.
well. Dr. Hagstrom, thank you for doing that today.
Thank you very much. Anybody else?
I
Dr.
just
Long?
have a comment. I just think this is such a great example of qualitative research, and how here's something that seems simple on the surface, like why wouldn't we do this? And yet the time that was taken in using a qualitative approach really mined for the gold underneath it, and that it's really all about learning to communicate and appreciate each other. And when you place that, you position that in the broader context that most of our medical errors occur because people aren't communicating, it really, all of a sudden, this qualitative study has huge significance, for solving a gnarly, sticky problem that, we haven't been able to solve yet, and that people are dying because we can't talk to each other.
Right.
And so I just really want to commend you, and I think it's a really fascinating example of what can be learned by going deep, taking a deep dive into something that seems simple, but it's actually really complex.
And it was so fun.
Yeah.
I even from, when you start a doctoral program, they tell you from the beginning to have an idea of what you want to do for your dissertation, just kind of an idea, and then everything that you do along the way kind of get something that's related to that, so that you're growing your idea the whole time. I never thought about anything quantitative. I was always a qualitative girl. So.
Well, you did a great job, and I think it really highlights the importance of what can be learned by this kind of research. So thank you so much for your contribution.
Thank you very much. I enjoyed presenting to y'all today. This was a great opportunity to share.
Does anybody else have a question for Dr. Hagstrom?
Just to kind of piggyback off of Dr. Long, I can also see where when you have the relationship with certain entities and different departments, you're more willing to call or make the phone call to PT or to the physician if you've already established some sort of relationship compared to, oh, this doctor is on, okay, well, I'll just pass it to the next shift.
And you know, they don't ever say that about nurses, you know. Like when the doctor's on call, they're like, I'm not going to that floor because so-and-so's the charge nurse that night. I hope they don't say that about nurses. Thank y'all very much.
Very much.